Hey guys, just a quick final video for following the SpaceOAR fiducial marker procedure and removing the stepper. It's important that following the procedure, the urologist will hold the cradle and loosen this nut and pull the probe out and then tighten it. That way you can get in there and unlock these 3 locks. You know, obviously the foot of the bed won't be on at the end of the case, so you'll be able to get in there easily and then just pull the whole apparatus with the probe still attached in the cradle away. That way the staff can get in there and take care of the patient while you take care of turning over the equipment. So again, be really careful because the probe is still in the cradle at this point. So the best thing to do is put gloves on, unlock this nut here to lift the latch, remove the probe from the cradle. If you have a kick bucket or a trash nearby, it's good to just slide the probe cover off right into the trash. Put the probe back on the ultrasound cart after you wipe it thoroughly. You can use disinfecting wipes that the room has to do that. And then, be really good about getting into all these crevices and areas with the wipes, because you don't ever know where, some blood might have gotten into, especially underneath the cradle around these knobs. Even though they should drape the stepper during the procedure, the knob, by the urologist just touching everything, sometimes blood does still get in there. So make sure you wear gloves, get in, as much as you can around everything. This cradle actually comes off, so you should angle it until it pops off. That way you can clean the underside of it and get it a lot easier, and get around this area a lot easier. To put it back on, you have to kind of come in at a high angle. It's kind of tricky to get it to come on and off. So you have to come in so that this notch, if you can see, the little notch is in line with the kind of U shape of the cradle base. So you come in almost like vertically, and you'll feel it kind of catch and slide on so it stays on locked like that. And just make sure you wipe pretty much the whole stepper apparatus. Make sure you get underneath the nut here, because the same thing, sometimes there's blood that gets under there by the urologist just constantly turning it. Get around where all the locks are. Sometimes there's blood that got into the base part here. Do the wheels, because obviously you might be rolling through blood when you pull back, just to make sure everything's clean. That way it's fine for the next case and for transport. For packing up this device, you do want to make sure this is locked, so this latch isn't just opening and closing. You should take this cradle off the stand, and there should be an accompanying black case. It might be in the van, or if you did bring it in, it should lock it in the case and transport it with the case when you're driving down the road, instead of just keeping it attached to the stepper. That way nothing damages the cradle. And you can also make sure that this bolt is tightened on all the way. That way it doesn't fall off in transport and you lose it, because then we'll be kind of tricky to attach it for the next case. And then you can just fold the arm up just by loosening this nut here. Just collapse the arm so that it's kind of level in line with the base, and that makes it a lot easier to secure it in the van. And that's pretty much how you pack up the stepper following the procedures, or for turning over between procedures. Good luck.